Everybody. Thanks for joining us. As some of you might know, I'm Tony from Mercy Perrysburg Family Medicine, the Mercy St. Luke's Family Medicine Residency in Perrysburg. And as we do the third week of each month, give a talk on a different medical topic. And today we're going to talk about advanced directives. Advanced directives are actually something that is part of a bigger topic called advanced care planning, but I'm going to focus on advanced directives today. Advanced care planning is something where you're talking about goals of care. It includes advanced directives, but it also includes a discussion with your physician about things like code status. But today we're just going to focus on advanced directives. And basically, there's two parts to advanced directives. There's a living will and power of attorney for healthcare. And you may say, well, I've already done these. It's something I don't need to know. I've heard this all the time. But advanced directives have been in place since the early 1990s. And in my current role and in my former role in hospital settings, I have been the chair of a medical ethics committee, both at Toledo Hospital, St. Luke's, McLaren, and now Mercy. So I get a lot of consults of people saying, doctors or families saying, we want to consult because there's some issues related to care. And the very first things I always ask is a person capable of making their own decisions? And if they're not capable of making their own decisions, do they have advanced directives? So sometimes, as it says here, people wait too long to fill these out. My mother-in-law, who died, 3+ years ago, we filled hers out probably in the last month. Sometimes we're doing these things in haste, but it's a good thing to do it ahead of time when you have a more clear idea of what your health status is, what your quality of life is, and where you want things to go in terms of what you would want done and not want done. About 7 years ago, I heard a perfect analogy of why we should have our advanced directives in place. And I heard somebody talking about somebody taking their car in to get it repaired because it was making some noises, and they said they were just going to drop it off and let me know what's wrong with it and what the cost is going to be and things like that. Well, they got home and the phone rang, but somebody else answered the phone, and it was the auto repair place, and they said, well, you're going to need a new transmission, you're going to need some new brakes, you're going to need this and that. It's going to cost you about $5,000. And the person on the other end of the line said, fine, go ahead and do it. So the person who actually owns the car and took in the car said, who was that? Well, it was the auto repair place that said, you need all this done, and it's going to cost you about $5,000. And they're like, wait a minute, I didn't want all that done. It's an older car. I just wanted to see if it was a quick fix. It's something I'm really not wanting to put a lot of time and money into. And so I think about advanced directives as that kind of same scenario where we might not have wanted a lot of things done, heroic measures, but if we don't share that with someone, we're really not going to, the person who is going to potentially be making some decisions for us is going to be potentially agreeing with some things or making some decisions of things that we really don't want to have happen. In the state of Ohio, there is a pecking order of who makes decisions for you in the absence of advanced directives. So it would be yourself first, and then if you have a court-appointed guardian, would be second. Otherwise, we start looking at family members. It would be spouse, and then majority of adult children. And I've had so many people say to me, well, my daughter will go ahead and make all the decisions for me. And I'll say, well, do you have more than one child? Yeah, I have a son as well. But, he's not somebody that really wants to get bothered with this kind of stuff. So I'll just have my daughter do it. That's, well, you have it written down? No, not necessary. As I said, majority of adult children. So what happens when mom's on in the intensive care unit on a ventilator, and some things need to be decided about where we go from here. And the daughter says, yeah, she really doesn't want all this done. Let's go ahead and pursue comfort care only. But the son comes in and says, whoa, whoa, wait a minute. You know, maybe he might have been estranged from mom and wanted to make up for lost time. I've seen many people, I don't know why they all live in California, but the ones that come in from California that haven't seen mom or dad for a few years and say, you know, let's do everything because now they want to make up for lost time, but they're taking care of their own emotional needs and not really respecting what mom or dad would have wanted done. So it's very important to have these things in place. My number one apology today is I did not bring any of the copies of the forms with me. I can certainly bring them with when I come back in February. If anybody's interested, I can give them to Danielle, or you can simply print them off on the off the website, and I'll let you know about that here in a second. So after a majority of adult children, it is majority of siblings. Again, you know, you might not have been somebody who had children or anything, so you are, you have a brother and a sister, and you might have the same thing. The other thing is, there might be two, if you had three children or three siblings, and two of them say, yeah, let's do this, and one of them says, we're not gonna, I don't want this done, and we're not gonna do this for mom. A lot of times they'll start to threaten the staff with, you know, say, I'm gonna sue you, I'm gonna take you to court, and a lot of times, you know, healthcare teams or healthcare staff will back off. So it puts them in a very precarious position. That's why it's always good to just do these things ahead of time. My number one take-home message is, even though these are legal documents, it doesn't have to cost you a dime to have them done. If you, I'm certainly not promoting our office practice here, but we do these in our office. As long as they are properly completed and witnessed or notarized, that's all you need. It does not have to be done through an attorney. Attorney offices will generally charge you around $150 to have these done. You can get them done in about 15 minutes. And two people need to witness it that are not related to you by blood, marriage, or adoption, nor can it be your primary care physician that witnesses these or a nursing home administrator. So like myself and one of the nurses in the office can witness it. It's totally fine. So pertaining to healthcare power of attorney, like you said, if there's somebody where you can appoint a primary person, and you can appoint a secondary person. But my message to you is make sure that you please have a conversation with whoever you're looking to appoint as your power of attorney. They need to be able to look you in the eye and say, I'm going to respect what you have or what you want and don't want, and I'm going to follow through with things. I was the youngest of four children, and my mom appointed me as power of attorney because my sister and my brothers would have kept my mom alive, you know, for whatever reason, just because they didn't want to let mom go. But she knew that I was a person that would follow through and respect those things. The other thing is, if you already have these things in place, please take a look at them. I've had a lot of people who have done these 10, 15 years ago and have never looked at those documents since. And they might have a power of attorney listed who has died, who has developed Alzheimer's, who they've fallen out of good graces with, and it's not somebody that they want to consider making decisions for them anymore. So certainly take a look at that. The other thing is with healthcare power of attorney, it only goes into place when you are no longer capable of making your own decisions. I've had a lot of situations where family will come in and say, well, I'm my mom's power of attorney, and that's it. That's great. You have the documentation? Yep, here it is. That's great. I'm happy to see that. But your mom's still capable of making her own decisions. So what she says is what is going to dictate how we go about things in terms of affording proper care for her. The other thing is, please make sure that if you do get your advanced directives completed, that you make copies. When we do them in the office, I always give somebody like 4 copies because I want to make sure if you're my power of attorney primary and you're my secondary, that you have copies, that a copy is given to my primary care physician, that they can scan into the system. And then it's a pain in the butt because you go to see a specialist and they're going to ask if you have these. And you may say, yeah, but I've already given them my primary care physician. There are different electronic health records out there and they don't communicate with one another. So even though you might have given your primary care physician, that system doesn't talk to this system. So it's just good if you have to go to a nursing facility for rehab, if you need to, if you go home from the hospital and you need home care, they're probably going to ask for a copy of those things. So it's good just to have extra copies. The other thing pertaining to healthcare power of attorney, on one of the pages on the inside, it talks about what your person that you're appointing as your healthcare power of attorney can and cannot do. The very first thing is you've given them permission of whether or not to have access to your health records. If you give them access to your health records, that is the one thing that happens right away. They can, request copies of something that, if it's necessary. Otherwise, the rest of their responsibilities don't go into play unless you are, again, no longer capable of making your own decisions. Living will is something that kind of goes hand in hand with it. But the interesting thing about a living will is that it only goes into play under 2 conditions. Number 1, you're terminally ill. So maybe you have an end-stage cancer or end-stage kidney disease or something like that. Or you're in a permanently unconscious state, meaning that you're in a like a comatose kind of condition. Excuse me a second. On both of these forms, there's a box a little bit further down, and it's a big blank box. And this is where you can write in any specific instructions that you want. Now, somebody that, like me, that's been in the healthcare profession for 35 plus years, I know what I want and I don't want. An example would be, I'm willing to be on a ventilator for 10 to 12 days if it's medically necessary. But if we get to the point of where we're not able to wean me from that ventilator, take me off. I used to work in dialysis a long time ago in the renal field, and I'm willing to do dialysis for a short period of time. But if we get to the point of where my kidney functioning is not going to come back and I'm permanently going to be on dialysis, take me off. I don't want to feed into them. These are things that I specifically put in my instructions. So you can put time limited things in there. Or some people just say, you know what, I'm going to leave it blank because I'm going to let my healthcare power of attorney know what I want and don't want. And I'm going to have this conversation with my primary care physician who's going to document some things and we'll be good to go. But again, the living will is something that's very specific to disease states and to your condition. So the majority of people who end up having chronic health conditions and end up dying, they really don't fit that criteria of the living will document going into place. So my other take-home message is if you do nothing else and you only complete one document, make sure that it's the healthcare or durable power of attorney for healthcare. Because that is the one that somebody's going to be able to make decisions for you if you're no longer capable of doing that for yourself. You know what else to say? Yep. I can talk about this for a long time. So like I said, where can I find these forms? I have a couple of things listed there. Probably my go-to is the Lucas County Probate website. These forms have been updated numerous times since the early 1990s. And I think now we're on like the 8th edition or something like that. But if you go on, just type in Lucas County Probate Court, and then you'll see eventually a little box that says advanced directives. You click on that, and it'll give you the forms to be able to print out. It's about 23 pages, but it is. I don't know if any of you have your forms completed. I don't ask that, but it's very simple to fill out. Like I said, you just need a couple people to make sure you're filling out properly. The other thing is on these forms, there are boxes that you initial, actually on both boxes for both the power of attorney and living will. There's a box that you initial that says if there was a form of treatment that was started that you would not have wanted done, that the healthcare team has been given authorization to stop it, which is kind of nice. Because then they'll confer with your family and they'll say, yeah, this is something I didn't want done. Know that you can change your mind at any time. You can change your mind about what you want done and don't want done. You can change your mind about who you want as your healthcare power of attorney. You just need to fill out new forms, and the new forms supersede the old forms, meaning that they're the ones that are now the most active. I encourage you to, a lot of people think that talking about death and dying is morbid, and have some uneasiness about doing that. But I would say the best time to have this conversation is to surprise your family or gangster them at the Thanksgiving table, because then you have everybody there and everybody's hearing the same message about things. But it's good to open up those lines of conversation. The other thing that I want to say is, if you're thinking about these things, the next time you go to your primary care physician, initiate the discussion with him or her. Statistics show that 50% of the time, the physicians are waiting for the patient to initiate the discussion with them, and 50% of the time, the patient is waiting for the physician to initiate the conversation with them. So somebody has to be the catalyst, and it might as well be you to get things going. Again, the last thing is, code status. This is Ohio's code status. It's extremely confusing because we have what we call DNRCC, which is do not resuscitate comfort care, and do not resuscitate comfort care arrest. And they're quick place based on what your medical condition is and what will be done up to a certain point and when. And sometimes you can do little caveats of saying, I'm willing to do medications only, but and chest compressions, but I don't want a ventilator, or I don't want other things done. So this is a conversation that you have to have with your physician. And when I say physician, I also mean nurse practitioners, because certainly they're valuable, valued part of the healthcare team, and they're able to sign these. But this is a form that needs to be signed by the physician and documented that they've had a conversation with you. I don't want to further complicate things, but at some point in time, this form may be going away because there are other states in the country. This is why my sons just wait for me to talk, because then they know I'll eventually get quiet. there's another form that is looking to be adopted in Ohio called which is physician orders for life-sustaining treatment. And it'll be a lot more clear than what we have in Ohio. That's currently confusing, but that in a nutshell is advanced directives, and hopefully it gives you a little bit more clear idea of things. Again, if anybody's interested in the forms, I would gladly bring them to Danielle next time. In Ohio is very peculiar because Ohio has its own form. In 43 other states in the country, they have something called 5 wishes. But Ohio's like, you know what, we want our own form. So that's why it's a little bit different. But for the most part, over the last 40 years, they've pretty much remained the same. Any questions?
I have a question about the DNR. If you check that box on the advance directive, is that all you need to do?
No.
Okay, then what do you do?
You need to have a separate form. There's a separate DNR form that lists. I don't know if you have access to the website or to the web.